Welcome, everyone, to Let's Talk. Our session today is titled Systems Building Models Discussion. I'm Debbie Mathias from the BUILD Initiative, the director of the QRIS National Learning Network. Before we begin our session together, I'd like to thank the Alliance for Early Success and other generous funders for making this learning community possible. We began this series for state quality administrators and leaders to support their important work within states around early childhood systems building. Quality administrators are welcome to invite other participants as related to the specific topic of the call. And we know a number of you invited colleagues interested in systems development, such as those focused on quality improvement, implementation, and other cross-sector partners, such as Head Start collaboration directors, education and early intervention leaders. We intentionally keep the session small to invite conversation and sharing. We hope these calls enable us to share challenges, innovation, and promising practices. After the session, a survey will pop up asking for your suggestions, comments, or questions. We appreciate your input and ideas, and we'll follow up with resources as requested. If you're working on a promising practice or facing a challenge in your state, send me an email and we can develop a Let's Talk discussion around the topic. Thank you for taking the time to answer the questions when you registered. Many of you provided thoughtful ideas and questions, and we reviewed the information and it's informing the presentation. In fact, we added some resources about cross-sector monitoring on one of the last slides in this session today based on the registration comments. Make sure to use the chat box. Enter your thoughts, ideas, and please contribute experiences from your state to the conversation. It really makes it germane to what your context is and really teases out nuances that Karen and I might not bring up. As you know, the topic of systems development and cross-sector participation in QRIS really got launched and moved forward with the Race to the Top Early Learning Challenge grants, where they super encouraged us to think about how are we knitting together an aligned, coherent early learning system. This conversation lays the groundwork for further discussions about more robust participation by Head Start in the state quality system. Karen Ponder and I have been thinking about cross-sector work in state systems building for a long, long time. And when you read her bio, you can understand, let me just click, there we go. You can understand why I would say that. She was the CEO of North Carolina Partnerships for Children. She thinks and works a lot with community partnerships, and she contributed to the development of North Carolina pre-K planning. So, Karen, hi.
Hi, Debbie. It's nice to be on the call.
It's great to have you here to chat about this with me today. So without further ado, we'll progress in the session. We're going to begin by setting the stage, talk a little about vision and theory of change, delve more deeply into the functions of an early childhood system, and then really think about the different sectors as we think about cross-sector QRIS, and look deeply into the functions and how we would work in those areas cross-sector. And at the end, we'll think about, has this impacted our considerations or thinking? Actually, this webinar came from an idea when I was thinking about cross-sector work in QRIS, and I tried to make some diagrams about what I was thinking, and so I'm really looking forward to your feedback about does this representation work for you? Does it bring new ideas to mind? So I am really looking for your feedback on how you think this presentation works and whether it gets to some new thinking. If you want, in the end, we can make it available as a PowerPoint for you to use if you think it's helpful in your considerations within your states. So moving forward, why think about systems models? Well, I think in stepping back from the day-to-day implementation work, it gives us a moment to consider the values and principles of the work we're doing and committed to, the equity within our systems building, what are the necessary systems, services, and components of the work that we're building and the alignment between those, what are our core strategies for improving early learning within the state, and what are the actual outcomes, benchmarks of success that we hope to achieve. In the beginning, there's the vision for the QRIS system in your state. Many states have articulated a clear vision of their system building. Some states have developed guiding principles, logic models about the inputs and outcomes of their system building and what they're working to achieve. States have put this thinking together in all types of configurations. And you can reflect for a moment on what's the backdrop of the vision, the guiding principles, the logic model of your own system, and think about that context as we proceed through our discussion today.
Debbie, I just want to mention that when we launched our first, actually our second QRIS, but it was the system that our state now has in place in North Carolina, we were definitely focused on raising the floor for children in all the programs in our state, regardless of sector. So we wanted to stop the debates about which sector does the best job, but recognizing that what happens in any setting is what makes the difference for children. So it was definitely a systems unifier for us, and we've continued to grow it and change it over the years. It helped us that Head Start was already in our licensing system, so that wasn't a sector we had to bring in. We were already together with child care, but public schools were not in our system of licensure. And so it took a lot of partnering and a lot of arm twisting and other things, starting with the state superintendent, although we didn't have to bend his arm, but we did, as you can imagine, people that just didn't understand the value of being one system. But we were able to move all of our public school programs for young children into our licensing system, which really gave us, for the first time, one system that then we could address through our QRIS system. It was the right thing to do to build consistency across the sectors.
That's a perfect example and really sets the stage. Some states, right from the start, especially those that came later to the QRIS and were engaged in Race to the Top, were thinking cross-sector right away from the beginning. But many states in the early days began the QRIS really as a strategy to improve the floor of licensing. And there's a paper referenced at the end of the session today where you can read more about the different models and perspectives that states have taken in their system building in terms of which sectors they've involved and how their vision and mission is played out. Well, why don't you keep going here, Karen, for us?
I wanted to talk a little bit about the functions of the comprehensive early childhood system, as you'll see on this slide. And I think everybody probably knows this, but this view of this part of the world was created by an early childhood systems working group, which we fondly call ECSWG. This was somewhat of the view that we were using with our systems work in North Carolina at the time. This was the early 2000s. And we convened at the Smart Start Conference, the first group of national leaders to work on a collective vision for what a comprehensive early childhood system should be. So there were many phone conferences, a variety of versions of this document. I've got so many in my computer, I have to look for the latest one when I get ready to use it. But there was much discussion and even debate through the years that have followed. But this is the current picture of what that looks like. And by the way, if you want to read more of the detail of this, if you haven't, it's on the buildinitiative.org website, and we will give you this link later or send it by email. But you can get right into this work and see the various versions and some tools that may be helpful to you. One change we've suggested is the function at the top, which is now labeled governance and leadership, used to be called leadership and coordination or something like that. And so we felt like that the governance and the leadership are critical together and that we should make that explicit. So these are the components, and then we'll discuss them a little more in detail. Here they are. This is the conceptual framework for the quality rating system, and looking at what are the drivers that make it work and that make it successful. And then we'll talk about each one of them in detail in just a few minutes. But just kind of keep this in your mind as Debbie talks about some different ways of thinking about this and how it might all work together.
Okay. Over the next 6 slides is something, and I really want your feedback about if you feel this representation works for you in thinking about how we're bringing cross-sector programs together. If we think about what we just saw in terms of the health sector, the early learning and development sector, and the family leadership and support sector, I located licensed regulated child care right under those as almost the base supporting the development of systems. And so you'll see that that little, I guess it's a parallelogram, represents the licensed and regulated child care in the system. All right. This picture, you can still see slightly shaded the licensed regulated child care, and the big circle in the middle represents a typical QRIS. Each state is a little bit different in terms of how far the QRIS representation might go into the health sector or the family sector or the early learning sector. The way you've established your standards in the state might be an oval that reaches a little more into health or family, or a little taller oval that reaches a little deeper into early learning and development. But what I'm trying to represent here is just a typical QRIS. It builds on the floor that licensing brings to the table and scoops in some elements from each of the different sectors of the comprehensive system. Now to Head Start and Early Head Start. Typically we find a deeper reach into the family support area and into the health area. And so you can see that this oval almost usually covers the QRIS oval, all right? And now we have a typical state pre-K program, maybe not going quite as far as Head Start into the health and the family leadership part, but going more into the early learning sector. You might have a requirement that in the state pre-K program, the teacher is a certified early childhood teacher. You'll be thinking about how many of the near benchmarks is your pre-K program meeting? Those kinds of things more come to bear. More depth in terms of curriculum, assessment conversation, and things of that nature. Maybe a little less on family engagement and support, maybe a little less in terms of requirements on the health side. So when you look at it all together, you see the base we began with, the 3 ovals: the family leadership and support, the health, the early learning, and you can see how we've positioned the Head Start oval reaching more into health and more into family, and the pre-K certified teacher reaching more fully into the early learning. Again, some QRISs might have a variance in terms of do your standards, push more into family leaderships? And if you can comment about how you see this drawing in relationship to the structure of your own QRIS. When I look at this, it makes me think that the QRIS serves as a consolidating body. It covers a lot of the bases. It's based on licensing, but in some cases it's not as robust, reaching out to the as far as Head Start does, or the pre-K programs. Anyone have a comment about that? I'd like to unmute you for a minute and just get your reactions to what you're thinking about this.
The conference has been unmuted.
Does this resonate with you in terms of how you might look at the QRIS and relationships? It was interesting. One of the last times that Karen and I presented this, one person said, oh, this is like a financing map. Head Start's financed bigger than the QRIS, or pre-K is financed bigger than the QRIS. And another person said, oh, I saw it as a standards map, that the standards for Head Start reached further into the health or the family leadership, or that the standards. So do you see this as a standards map or as a financing map? And how does it resonate to the way you put together a cross-sector piece of work? We see someone commenting in the chat box that this is pretty close to how it's set up, with connections to the registry system embedded in licensing, and they use the Head Start standards to formulate many of the standards. To the person that made that comment, do you want to talk about that a little bit, so you don't see the QRIS standards maybe reaching as far as the Head Start performance standards?
So, hi, this is Karen. I'm with the state of Colorado. So when we were building our QRIS, we did embed it in our licensing so that the quality elements weren't written into the licensing standards, but that there was a mandatory element to participation within QRIS if you're a licensed provider in the state. So that's pretty different than most states have done it. I know we've been getting quite a few questions about how we pulled that off, but typically, we have a health element, we have a family leadership element, we have a child health, all built into our QRIS standards. So we did use some of the foundation of early Head Start and Head Start to develop those standards. And then, of course, we also are connected to our central registry and teacher qualifications, which would include our pre-K as part of our QRIS as well. And so,
now,
it's pretty seamless.
Karen, did you say that you included, does your circle reach all the way out to include all of the Head Start and early Head Start standards?
I would
Or
not say it includes all 1,700 plus standards.
Okay.
No. So, but we use
doing that, right?
yeah. We had to keep it, manageable for those who don't participate in Head Start. But we did use Head Start as a foundation for building some of our standards. So some of those elements that are super important to family engagement, they were already there and they're already researched. And so we used quite a few of those, the premise of those standards, to develop our own family engagement section of our QRIS. Additionally, some of our health standards, so we have a whole separate child health section within our QRIS. While those didn't connect directly to Head Start, it was kind of a start of, what am I trying to say? Some of the child evaluations and things like that are required through Head Start, vision, hearing, those sorts of things that those students go through. So we included that in our QRIS because we have a pretty small grantee population in Colorado. It's only about 34 of us, 39, something like that. And so a lot of programs haven't been exposed to those higher, deeper standards that Head Start includes. So we just honor and recognize and award points for programs who are doing that. And then our Head Starts get an alternative pathway into our system.
Yes, and we're going to talk about that more too. Thanks for bringing that up. What you're saying, Karen, makes me think maybe if states are picking this circle as their QRIS standards, they may be supporting through technical assistance or professional development, best practices or whatever, that the standards out here that Head Start has that aren't encapsulated within the monitoring and measuring part of the QRIS are part of the CQI framework for the state. And the same thing here with the typical, pre-K program, that these standards around assessment, assessment informing the work in the classroom, these could be things that are supported in professional learning opportunities and that are aspirational but not within the monitoring and measuring. So I thought you brought up a really good point there about we're still looking to Head Start or pre-K as best practice and outside. We have another comment in the box that they agree that this diagram, and if you want to speak up and tell us about your point of view, that it's what you know of the QRIS, and I look at it, I realize how helpful it might be to take this to our STARS Oversight Committee to use as a tool for conversation. We're having our annual retreat tomorrow. And so it might be a little late for tomorrow's meeting, although I could send you the PowerPoint, not in a PDF if you want me to. So, but I was thinking that it could be interesting and that some might push this envelope. Did you want to add anything to that comment?
Hi, this is Amy, and I'm in Vermont. And it would be great if you wanted to send me the PowerPoint. I don't know how much flexibility we have in our schedule, but it would be really useful. The only thing that I would say is we don't have a separate health domain, and so the health is sort of, interestingly, really where we see it mostly is not in program practices where I'll be candid and say I think it would be better seated or housed, but it's more in our sort of families and communities domain. But these are the conversations that we're having, and this, I think, would be a great tool to use.
Oh, good. Thank you. A lot of people on the health side in the QRIS are going beyond some of the baseline licensing, talking about child obesity or other things that they haven't been able to quite get to, and TV and screen time or some things like that they haven't been quite able to get to in the licensing. When I initially started this, I had this little licensed child care embedded up here within the QRIS instead of on the bottom. But people kind of objected to that because they said that makes it look like licensing gets to the crux of everything.
Right.
People were seeing it more. I moved it to more on the bottom. Well, great, Amy. I'll get your email address and send this along to you when we're done today. Okay.
All right.
And the
I'll type it right in.
And the whole session. Okay. And the whole session will be posted on in the webinar area. I want to show you. I was kind of now if I can turn my arrow off. Okay. As I was thinking about this, the next drawing shows something that's different, but somehow in some states people are seeing the QRIS, the Head Start, and the size of the QRIS is just relative to the size of a child care typically within the state versus the size of the Head Start population or pre-K population. It is the biggest child serving unit typically within a state. And here I do have the licensed and regulated within it. Now I didn't draw all the little concentric circles, in here that would be level 1, level 2, level 3 because I thought it got too confusing. If states have set up, in a way, you could say that each one of these systems is its own QRIS. Head Start has all the functions that Karen discussed before in terms of governance, standards, quality improvement supports, and so forth included within their system. And pre-K often deals with the same functions that are within the early learning sector. In that case, if a state has set these up as a little bit of, different purveyances not coming together related to the QRIS, then it's incumbent to probably do a good description about how they're aligned and work together and coordinated within the state. But that description and telling that story would look very different in a state that has set up the systems within the state within this context. Anybody have when I showed this slide the last time I did this with a small group of people, everyone went, no, don't do it that way. But, there is some reality to sometimes the context of the state, pushes in this direction rather than a more integrative approach. Does anybody have a comment or anything they're thinking when they see this type of a diagram?
It kind of reminds me, Debbie, that in some ways that's how a lot of QRS systems began, but they have now moved to I think a higher level of functioning. It's a place to start, and it's an important. I can't even listen. But it's not. We need to keep moving until we have one system.
I liked what you said when we opened up, Karen, about it. It was every child in any setting was what you were trying to work toward and have knitted together. I thought that was great. Well, I think, does anybody have anything else about that body of slides that we worked through up to now about their reflections in terms of how it relates to what they're thinking about in their state? I'd like to thank Karen and Amy for chiming in. Anybody else?
This is Sang from Washington.
Mm-hmm.
So I like what you have there. It reminds me of our state just because we have the QRS in the middle, and then we have the Head Start, Early Head Start, and then our pre-K program is called ECAP. And so right now, just like Karen was saying, we have different pathways for Head Start and ECAP programs. And so right now we're trying to align like the licensing side and the pre-K, ECAP, Head Start all into one package instead of having it separate.
Mm-hmm. You know, in the upfront questions, one of the biggest questions that we got from folks as they signed up was I could tell people were really thinking about the revisions of the Head Start performance standards that require Head Start to participate, and concerned about have we done enough to establish alternative pathways that Head Start, you know, would typically say, almost because of this kind of a diagram and how they see the standards and the financing, that they would be automatically placed at the highest level. I'd just like to share just real quickly with you what it says in the new performance standards about this. It's under coordination with other programs and systems. And in terms of quality rating and improvement systems, a program, with the exception of American Indian and Alaska Native programs, must participate in its state or local quality rating and improvement system. If the state or local QRIS accepts Head Start monitoring data to document quality indicators included in the state's tiered system, and that speaks to the deep crosswalk and understanding this relationship that we're looking about how far does the QRIS go in relationship to the performance standards, and accepting the Head Start monitoring as an endorsement that Head Start program meets their performance standards. The next part was participation would not impact a program's ability to comply with the Head Start program performance standards. And finally, the program would need to provide the Office of Head Start with a compelling reason not to comply with this requirement. I know that the QRIS administrators are thinking a lot about how do we make sure that we have the correct pathway for Head Start participation. Have we been able to streamline and make very efficient our monitoring systems? How can we better integrate Head Start into the work? You know, we found that pre-K was often integrated more quickly than Head Start because the state often had control over the pre-K funding and actually drew it up as part of the whole system thinking and already established that alignment and how the interaction with child care or with the QRIS were going to be upon inception. Head Start with the federal to local funding was a different challenge for states in terms of working with Head Starts within the state, creating a coherent, aligned system. Karen, we're ready to go off to your part of this. Is there anything that anyone has to add about, or a further question about the Head Start part of this, or what you're thinking in terms of, is that going to be a big body of work for your group in the coming year to incorporate Head Start?
Yeah, adding on to what Karen said, so in Washington State, we made it mandatory as of July 2016 that that ECAP and providers that accept state subsidy be part of our QRIS, but for Head Start, we don't have any decisions over that to have them participate in our QRS system.
So now with the Head Start federal group saying that they should be participating, are you ready for them?
We are.
Good.
We are.
That's great. I think that one of the discussions at the federal level is how do states manage the financial commitment of including Head Start? Possibly not, and we'll talk in a minute about this, in the financing right, direct financing to Head Start programs, but there is a cost associated with the accountability and rating part of the work as well. And so that's something that people are trying to figure out within states. Karen, why don't we move forward here with our thinking in each of the areas?
Yeah, let's just look again at the whole of the functions or the components of a comprehensive system, beginning with governance and leadership, strategic financing, enhancing and aligning standards across all programs, creating and supporting improvement strategies that really work and move the quality up, ensuring accountability, which we know is absolutely critical, and then recruiting and engaging stakeholders. And we'll talk about each of these just a little bit, but as you look at the whole of them, I want you to think as we talk about them individually, are these the right factors? Have things moved? Are these the right functions? Have things moved forward in a way that maybe we're missing something? Or is there anything that's not needed in our current systems of quality rating? So if you look at our next slide, the interconnection among the quality rating improvement system components. And I know that if you're working in the system, you certainly understand how they all have to work together. But sometimes we focus on just one piece for various reasons. It might be the one we have some funding to do, or that somebody has said has got to be a priority. And so we want to make each of those independently strong, but sometimes we work on one at the cost of others. So how can we best connect to this picture here, the image of interconnectivity and interdependence, because we know they are very much interrelated. So while remembering that it takes all of them to keep the system functioning at the level needed for better outcomes, how do they each work together, each work separately to do its job, but working together to get a better overall system? And so the first area we want to just think a little more about is governance and leadership. And as I'm looking at the slide, I'm reminded that we put at the bottom of the slide financing, which is having adequate resources for all the to fund each one of the components, and then an equity framework that undergirds them all, so making sure that our systems are fully equitable for all children who need and want the services that we are providing. In terms of the governance and leadership, you might want to think about how in your state these three sectors, the three sectors Debbie mentioned earlier, the Head Start, child care, and public school programs, actually come together for stronger impact. For example, you might have a state advisory council or an ELAC or something that is functioning well to bring those sectors together. Or are there other entities or efforts that really provide the leadership in bringing the sectors together for planning and action? It's a really important consideration that actually builds the system stronger in a connected kind of way. Debbie, talk to us about standards.
Okay. I think in some ways this is the easiest of the functions to think about in terms of alignment. I know many of you have spent hours crosswalking your licensing standards, your QRIS standards, your pre-K standards, and the Head Start standards. When I start thinking about standards, I think about the early learning standards, the practitioner standards, and what I was just talking about, the program standards. So one question is, do all three of the sectors use the state's early learning and development standards? Understanding that Head Start might incorporate those within a broader picture of the Head Start performance standards. But, how widely used across the sectors are the early learning standards? Are your practitioner standards in place and representing a career ladder or competencies for people working in any of these sectors? Or is it specific to one sector? And then the program standards we've already talked about a little bit. How are they aligned? How are they connected? And do people understand the different breadth and scope of the standards for each sectors? I think, again, like we were getting to in one of the previous slides, thinking about, what is monitored and measured in terms of regulations or must-dos, and then what surrounds any one of these sectors in terms of best practices or what we're aspiring to that's really in the continuous improvement part of the work. Okay.
The next one to consider is ensuring accountability for the system you have in place. So asking yourself the question, how is my state demonstrating accountability for the outcomes of this system and the results for the children it serves? And one way to start thinking about that is to consider how each of the sectors is monitored and measured. So if you look at how child care, Head Start, and public school programs are currently being monitored and measured, are you finding ways to streamline their participation in your quality rating system depending on their current systems of monitoring and measurement? And what are they already being monitored for or having to report about that you could build into the system and not be duplication for those sectors? I think that's a critical part of helping people to not feel that quality rating is just something added on to what they were already required to do. And you do hear that when you're talking to providers. It's one more report, it's one more visit. But if they can see that the things they are being monitored on related to quality rating system are different and are leading to higher quality, then it's easier for them to participate and feel better about it. And then the other thing related to accountability, I think, is having a unified data system that all the sectors report into. Most states are moving in this direction, and many states have been working on it for some years now. But I think it's another way to level the playing fields across the sectors and demonstrate the importance of what actually happens within programs and classrooms, not where they're located. So just another way to think about, or a way to think about accountability and being able to demonstrate accountability to your larger community.
This was an area where we had lots of notes from what people were expressing as they signed up for this webinar in terms of eliminating the duplications of processes while ensuring reliable and equitable services, alignment of monitoring systems. And on the last slide, you'll see the reference for all of the materials that the feds have put out about cross-sector monitoring and tools to actually help you think about how to align the monitoring and the cross-sector monitoring. I think that we're very conscious about avoiding the duplication of services and trying to stretch our dollars as far as we can while providing really robust services to families and children. Because this was such a big topic in the upfront questions, is there anything that people would like to add in or something that they're thinking about in their state, whether it's licensing getting more involved in, the first few levels or all the way through the QRIS in terms of helping with monitoring and designation, whether it's pre-K helping with QRIS monitoring. Does anybody have something that they'd like to add about where their state is in this area?
Debbie, this is Gail Nelson from Illinois. How are you?
Gail.
So I would share just a couple of things from Illinois. We were very fortunate that our state-funded preschool had a monitoring system that was contracted to the same assessors as we're already doing our child care centers in our former QRIS. And we were able to take the monitoring data via a direct data dump. There were all kinds of standards that were at or above ours or that didn't relate to the QRIS, but the ones that mattered for compliance with overall preschool for all funding in Illinois, if they met that standard, then we took the individual site-based classroom quality scores and assigned circles of quality, and we did the whole thing in an annual data dump. So it was efficient for the school program. It was efficient for our state system, and all of the schools were really thrilled when they and their principals received notification of their enrollment in the QRIS at the circle of quality to which they were assigned. The other thing we've done with Head Start is we've done an expedited pathway where we're taking the bulk of the evidence as the Head Start federal monitoring results. Just straight up send us your letter and let us know where you are. We don't have health standards, so if a child is missing a dental, that's not a problem for the QRIS. But if they have findings in any of our other standards, then they would not be eligible. But if they're clean otherwise, then we send out the state assessors just to get the site-level classroom quality data. And that, again, is an efficiency for the program in Head Start as well as for our state system in terms of its assessment resources.
Well, you know, I almost think that expedited pathways point that you made up, that you were talking about there, could be a whole discussion in a Let's Talk, because each state has very interesting ways they're handling that between pre-K and Head Start in terms of how their standards work together and how they're incorporating Head Start. Yes, so it's very interesting. Even Karen was talking about data systems here. I know on a lot of the state data where parents can search for child care, they can also search for Head Start or pre-K programs in the same search function. And it's interesting when states make a choice to do that because they're then also labeling the Head Starts and pre-Ks with a star level, just like the child cares are. So when a Head Start goes through that process and is rated at a star level on the display for families looking for Head Starts, they would know that that Head Start was incorporated in the STARS program. So I think that one of the challenges with the Head Start and the monitoring side has been how are we setting up good communication strategies to talk with the monitors of the Head Start programs about was that program in compliance, or what are the systems we have to be notified if a Head Start is deemed not in compliance, and how do we review their areas of compliance or not compliance in light of the QRIS, to the point that someone just made. If they're not doing their dentals and that makes them not compliant for Head Start, but that's not a factor in the QRIS, do you remove the star level because they're no longer in compliance with Head Start or not? You know, and those types of decisions I can see us getting more deeply into, and with our Head Start collab directors or with our Head Start community, and trying to tease that apart and figure that out. So the example you gave there, Gail, was perfect, to thinking about something like that, where if a Head Start, has a ding or has a problem, or if you don't have class scores and they don't get the class scores and are put into recompetition, is that, does that matter in their their STARS or QRIS standing? So these will be things that we'll get more deeply into discussing, I'm sure, as this policy holds out.
So then they have to use the select.
Okay.
Right? For us?
Anybody else? We have a really like the idea of discussing how other states are handling. Does anybody off the top have anything else that they can share about Head Start? Participation?
This is Karen from Colorado. Can you guys hear me?
Yes.
So this is something we've really struggled with, to be honest, but we did come to a place where we are right now, which is we do offer an alternative pathway for our Head Starts as long as they're in good standing with the Office of Head Start. So if they were to lose their good standing or be put on a probation that's not met, they would lose their quality rating within our Colorado Shine system. But that being said, we have yet to get to a place where we're doing a very good and strategic job of sharing data with each other, and people want to. We just are trying to find the time to get there and the resources and things of that sort. So it would be just an exceptional good use of my time to hear how some other states are collaborating and coordinating and recognizing or not, or the different ways that Head Start's fitting into their QRIS.
I know in some states they have still asked the Head Starts to do one or two things.
We did too.
So,
yeah.
In one case they might want still to have, because Head Starts do that class scoring, if that's not a part of your system, you might want to get a one-time, and because the class scoring isn't on every classroom,
that's why we don't use
on
it.
every facility,
Yeah.
even in every facility, it can present a question or a problem.
Yeah.
So these are things that people are working to sort out. And sometimes one of the asks is something like that the staff at the facility participate in the registry, for example.
Right.
Because the state wants to begin to get a sense of the statewide workforce data, and having Head Starts participate in the registry can be helpful to understanding the whole. So these are all big questions that each state is going at. I just wonder if we might get some more definition about this communication between the feds and the states, or a better understanding of how Head Start is participating. I'll look for some resources and see if we have something else from the Quality Center. They maybe can help us understand how states are participating, having Head Starts participate, that could be helpful to us. We got
Debbie, this is Gail again. If I could just add one thing.
Yeah.
We tried very hard to get site-level data on class, and we went all the way as far as we could. We didn't get to Obama, but we got close. we were not successful in that, and one of the transparency issues in our system is that at the end of the day, somebody is proving to somebody that they're doing the same thing. We had hoped with our pilot to find an association between the program level scores that do come from OHS with the federal monitoring results, which are at the grantee level, and what the site level scores turns out to be. And we were not successful in that. Mainly, it really varied with the size of the grantee, because, again, you never knew where they were actually administering the class. We did, however, as an enticement to our Head Start programs, we from the beginning included the option of class scores in lieu of ECHR scores, and we set cut thresholds for both tools so that Head Start can choose that. Where their disadvantage has been is if they have Head Start and early Head Start, because there is no tool required for early Head Start. So we would have problems averaging scores if we were using class for 3 to 5 classrooms and ITERs for birth to 3. But, yeah, there's a lot of work to be done on that. So
that's very interesting. And I'm just seeing a note that the Quality Center is working on a resource specific to QRIS and Head Start participation policies, and we're probably a month or two from release on that. So I think that we'll see these conversations coming to bear and some help. Now, Tierney, you wanted to say something?
Yeah, this is Tierney from Vermont. Can you hear me?
Yes.
Okay. So I was just going to comment on what another state had brought up. We also have an alternative pathway for Head Start programs in Vermont. It's not mandatory that they participate in STARS, which is our QRIS, but Head Start programs have to renew in our QRIS system every year, and we require documentation from those programs from the feds that they're in good, compliance with the Office of Head Start. And if we receive documentation that they are not, then they potentially could lose their STAR rating. However, we ask that they reapply using the full Early Childhood Licensed STARS application instead of using the streamlined application that we have for these programs. So,
that's interesting.
So they usually, and this has happened a couple times, they usually do remain at their 5-star level unless they had a serious violation in compliance history that resulted in a parent notification letter. Then they lose all their compliance history points. So that's how Vermont has dealt with Head Start programs that are in non-compliance.
And I think it's very interesting, the whole notion of grantee with multiple sites, right? And I know that many states are doing that thinking also for networks or for large child care agencies with multiple sites. What are the economies in monitoring in terms of a multiple site operation, but what actually needs to be confirmed or looked at the facility level? I think that was the reason some states still, if they had a tool like either CLASS or ERS, the environment rating scales that they were using, they still wanted that one tool applied at each facility, understanding that in all the other cases their standards were met, So these are big challenges and thinking that everybody's doing. And I think we're in a real evolution stage with the Head Start performance standards, wanting Head Starts to participate and be part of that state system, early childhood system. Okay, so thank you all so much for sharing these ideas, and I think there's more to come on this topic, but we wanted to just begin the conversation and the thinking about it. I'd like to talk again about each of the sectors when you're thinking about creating and the improvement strategies. So you might think about what kind of, for example, professional development is available to each of these sectors and from whom. What kind of technical assistance is available? This could make a nice little chart. Where do each of these groups get their support? I know sometimes because of the financing differences and that the QRIS work is largely funded out of the CCDF block grant, often pre-K programs, because they have a more robust unit cost per child, aren't eligible for grants and awards, right? And the same thing could be true with Head Start. But still we're beginning to see states evolve in terms of how they're conceptualizing professional development. We're seeing Head Start partners and school districts opening professional development up. We're seeing technical assistance moving between these different sectors within states, especially if things like early childhood mental health or some of the baseline health and safety. So we're really seeing states think about how can they maximize the different supports within their state and what sectors are they applying to. You know, actually this really brings up for me that in so many cases a provider actually is already including all three of these sectors within their facility. So in some ways the field and the programs have been knitting this together. How do they negotiate the supports, the technical assistance between the sectors at the facility level already? And they may have good stories and ideas to share with us. And I guess at that point I would also, even though it's more of a service, think about early intervention. I remember that our early intervention provider in Pennsylvania was an exceptional resource for professional development and learning around especially children with disabilities or children having challenges in the classroom. So, you know, how this is all coming together, you'll want to think about how does each sector look, what are the assets that each sector brings to the pot. I know that we've had a lot of school districts begin to do professional development between K and pre-K teachers and talk together within a community about transitions or assessment, curriculum, all kinds of terrific sharing and networking. And this also helps bring the whole system more in alignment and cohesion together. Karen, is there anything else that you think about or from the participants on the webinar, other ideas of how initiatives that are put out by the state have crossed the sectors?
I think you've covered the main ones. Let's see if we hear anything from our participants. Anything that we haven't mentioned around that? Char, I know you have a million ideas. You want to move to our next area?
I'll give you one more example. We had an annual one-book project that we did with our libraries, and we really included all of the sectors in that initiative, kind of hooking together libraries, early learning, and it was really a celebration across the sectors. So even with small initiatives that you're doing and the supports, thinking about, or state conferences or AUIC conferences, thinking about how are you reaching out and working with all the sectors would be something that you'd want to consider. But let's do at this point move to the next one.
Okay. So let's talk a little bit about recruiting and engaging stakeholders, because we know that this can either make you ride high or fall low. So who is it that you need to engage around this work? And the first level of stakeholders are certainly the providers. And as you know, some states have actually failed to be able to launch a rating system because they did not educate and get input from providers before they brought it out as a done deal. And that can literally take down your efforts. So if you are just planning or just getting ready to launch a system, be sure to pay attention to that. You need providers with you all the way. And there will always be vocal providers who may not get on board. But if you have enough providers who really get the importance and they value moving their programs to higher levels of quality, then you can overcome the criticism you might get from a few. The next group of stakeholders that I think are so important are families. We have to keep parents and other family members involved in learning why this is important, because they can think that it's going to raise their tuition for private paying families. And so helping them understand that it's quality programs that makes a difference in child outcomes, not just any program, and helping them become the advocates for it is a really effective way to move forward. And then communities, particularly if you have community planning efforts such as local councils or local partnerships or hubs or transformation zones or all the names they're called. But these community leaders and local stakeholders are really important in giving you advice and input into what might work better in communities, as well as convincing families and providers and community leaders that this is the right approach to take to improve the quality of our systems. And then certainly policymakers need to know all along the way, just to be educated about why quality matters and then what it means for the state, and to really understand that this is not easy work and there will be criticism of it, but if they understand the long-term goal and the outcomes that can be achieved, then they will partner with you to be brave and move forward. Remember, too, that there are differences in how you engage with different groups of stakeholders. Parents who pay for their services and those who qualify for services through subsidies may have different perspectives, and both those perspectives are important in engaging around quality rating systems. You want parents to be so convinced that quality rating systems will help their child that they're willing to entertain a lot of different perspectives on it and to stand up for it when you need them to be supportive. What have you learned in engaging pre-K and Head Start families, as an example? They can be great advocates for this because a lot of times their programs are funded at a high enough level to achieve quality. So engage them to share their knowledge and understanding about that with others. We want to know what you've learned in doing this work, and so be thinking about any ideas you have to share with us. And just one more thing, what about how do you get families and policymakers on board with you? You're the experts and you've got lots of lessons to share with everybody, so can we take just a moment and anything that's worked well for you? I'll tell you one from our story. In the earliest days when we were just getting ready to launch our quality rating system, we did a statewide campaign that asked the question, is your child care as good as your child? And it was kind of a simple message. We did TV ads and radio and printed, and it seemed very effective in helping families start to question the quality of programs, and then they saw the quality rating system as a way that they could know just from the alphabet letter whether it had certain standards in place. What have you tried? Don't be shy.
This is Fang from Washington. So we have a new committee this year. It's our QRIS review committee, and so we get a lot of parents, and then we have the policymakers, people from our department get together, and they talked about the changes that they're going to make in our QRIS system, and then they make decisions on if we're going to move forward with it or they don't want it. So
are providers part of that or just parents?
Oh, yes, they are.
Yeah. Okay, that's great. So it's you meet regularly to discuss the various issues and possibilities.
I think they get together like every other month or quarterly per year.
Good.
Yeah.
Great idea. What else? What else has worked for you? Debbie, anything come to your mind?
I think one of the biggest challenges here for me has always been family engagement and bringing the families to the table about, when you're building a system for families and children and building it without the voice of families, how do you know that you're hitting the mark, so to speak, and that you're, creating and building services that will really help them in their lives and with their children. And so I think that family voice, as challenging as it can be to bring to the table, is one of the most important parts of the work.
Debbie, I would just say that the closest people to family voices are the local communities. And if you can, whether you have a formal local partnership or council or not, if you connect with groups that work with families at the local level to start engaging and getting input from families, it's such an important part of the state's work. So I would just encourage that there be sort of formal feedback ways to get that kind of information from family voices. Michigan has such a good model for hearing family voices because they've actually created family coalitions for that purpose I think there are 40 across the state of Michigan. So with something like this, then they would take the issue to those tables where family members come together on a regular basis to discuss the state's work. But I know there are other models for that as well.
That's great. And there are some good pieces of literature out about provider engagement and family engagement that I wouldn't, because this was actually one of the upfront questions as well about public relations and engaging providers and families. So I can tell it's an important topic. And I think that I liked what you said, Karen, about thinking about how are we engaging pre-K and Head Start families now as well. So what are the assets? Obviously, family engagement is one of the biggest things and most important in Head Start. And so they can be a good model also and bring ideas to the table about effective strategies in this area for us. So really looking at these other sectors other than childcare as what assets do they bring to the table and how can they help the whole improve and get better. We're almost heading to the final slide, but before we get to that, I want to talk a moment about financing. But before I do, I'd like you to make sure that we've heard and that all of your questions and thoughts about the different things we've talked about today, please go to the chat box, and I have a few challenges that folks put up front that I want to tease out a little bit. But first, I just wanted to talk about financing. Considering about how each of these sectors is financing their accountability and rating process, and the money that's already being spent by Head Start or pre-K, and how to leverage that in light of the financing for the accountability and rating system. Thinking about how you're financing the quality improvement supports and how those quality improvement supports are financed by each of the sectors. And is there room here for better coordination of those quality improvement systems? And finally, the financing for the programs themselves. Karen and I have alluded a little bit today that in most states, Head Start and pre-K have a stronger funding stream, and they have bigger standards potentially and so forth to meet. But so thinking and understanding clearly how each of the sectors is financed within your state can help you come to policy decisions about where the financing comes for the improvement support or the accountability and rating. And those we've seen as the biggest sources of the biggest activities that need to be financed. And of course, the biggest of those is the services themselves. Okay? So I just wanted to make that statement. We didn't forget about financing, but you can see that it was really embedded across as we talked about each of the functions. Finally, getting to the closing thinking. Has this discussion, clarified or surfaced any thoughts for you about the functions in a cross-sector QRIS and looking at them specifically by functional areas and by sector? Have things changed for you in your thinking, or does this align with what you're feeling and thinking in your state? And as I look for folks to chime in the chat box, another question that somebody posed as a challenge at the beginning was a resistance to becoming licensed. And it's been interesting to me to see that states have handled that licensing question in different ways. Some have required licensing for pre-K and Head Starts, and other states do not have that requirement, and they look and see if they can establish a baseline or a equality between, let's use this example, the Head Start performance standards and what they do in licensing within the state. And if they do a careful crosswalk there, is there anything that's missing, that they feel like they need to address, or do they accept meeting the Head Start performance standards as meeting the baseline licensing within the state and not require that additional piece of work? So that question about different sectors being resistant to licensing leads you to the conversation about, can we afford to license everyone, and do we need to? And I don't have an opinion on that. I think there's a contextual piece to that within states. And does anybody have anything else about the licensing question? Like, Karen, I know you said that pre-K in the schools was not licensed, right, originally?
Yeah, the Head Start and Child Care were, but we had to convince public schools in a kind of a carrot and stick approach. But
you ended up bringing them into the licensing system, right?
And one thing that worked was we literally raised money to help them meet the physical licensing, the building codes and that sort of thing that were different in the public schools where they were serving pre-K and in licensure. So having that money available to help made a huge difference in their being convinced it was the right thing to do. Debbie, I wanted to add, anybody else talk about that first, because I have just a different thought.
No, go ahead.
I was just going to say that quasi-rating systems are not, they're not a stagnant strategy. I know that's not good language, but it's a changing strategy. So you start where you can and where sometimes you have to, and then you build from there. So like I said earlier, when we started, our goal was just to raise the floor for everybody, because we had so many children that were in child care, and we knew that the majority of the classrooms were not meeting the needs of the children. That's kind of where we started. So we wanted any program that a family chose to be of higher quality. We knew we had a long way to go, but we had to start somewhere. So that was kind of our way of launching. But even when we started, we knew that as we made progress, we would continue to move the standards higher, and that would mean changing policies to support the highest quality for our children. So an example of that is that because we've pushed to higher star ratings for quite a few years, that any child who gets a subsidy to support their care and their learning program, wherever it is, they can only be served in a 4 or a 5-star rated program. So that's now a statewide law that no longer lets us serve children who get subsidies in lower star programs. We could have no more done that when we started out than the Man in the Moon, because we didn't have enough of the 4 and 5-star rated programs in every single county, at least, to be able to do it. Through the work of Smart Start and the quality rating system, we do have that now. So it's just an example, but a reminder that where you are now is important, and then building higher quality into the future is also important.
That's such a great point, Karen. Thanks for sharing that with us. Is there anything that anyone else would like to say as we begin to wrap up today? Has this piqued a new thought for you, or? Another question that someone brought up in the pre questions was thinking about family engagement throughout the early childhood system. And I think that we talked about that when we discussed standards and the family engagement and how the vision of each of the sectors might have a slightly different take on family engagement. But the best practice of family engagement is becoming, I think, a really robust body of work that and a lot of good examples, from strengthening families to other tools that folks can use that programs can use, but also systems builders and how they're thinking about family engagement. So it's kind of at every level. We have someone in the chat box saying thank you. They like the family marketing idea that Karen shared, and we all loved, Karen, what you said about is your child care as good as your child? That resonated with a lot of people in the chat box, so thanks for sharing that one.
Debbie, Tierney O'Meara had said she had an idea to share about Head Start. Have we heard that yet? Am I behind?
Yes. Tierney, did you have anything after? We've talked about Head Start quite a bit here. Was there anything else from Vermont that you wanted to chime in about with that, or we're good?
Maybe she
might be on mute too. That's what I always do. We have someone in the chat box even wondering, Karen, if that could be a national campaign. Is your child care as good as your child?
Feel free to use it. That's all I have to say. We each have different ideas about this work, and I think the more we can share them and use them across the nation, the better off we are. But we'd love to see that somewhere else. Yes.
All right, so here's a list of the resources that we provided for this conversation today, and we're seeing someone else in the chat box thinking about provider engagement is key to family engagement. It's tough to get to families if you're not engaging your providers. I think that's really a great point.
Right.
And that they can be the key to engaging families. And also helping families learn how to engage in systems and in thinking about quality and become ambassadors for it, for sure. All right, Karen, is there any final word you'd like to share as we head to close here?
No, but just thank you, everybody, for participating. It's been a fun chat.
It has been. Thank you, everyone, for coming today, and let's talk again later. Bye-bye.
Bye-bye.
Hi, I just wanted to say one last thing, which is that I think the key to family engagement might just be provider engagement. Yeah. I mean, if yeah, I mean, I'd like to know more, I guess, explicitly about what are the roles and functions that you see for parents as, stakeholders or as advocates for quality. Yeah. All right. Thank you so much.